Which one of the adrenergic drug increase the force of contraction without increasing the heart rate? Dobutamine. Ergotamine is used in migraine because it causes vasoconstriction. General anesthetic is useful because it causes muscle relaxation and unconsciousness. Among stages of general anesthesia, second stage is called excitement. Which one of these barbiturates is used as IV anesthetic? That is thiopentone. Which one of these is non-barbiturate used for pediatric anesthesia? Ketamine. Chlorpromazine is given before anesthesia to alleviate preoperative anxiety. Barbiturate causes death at toxic dose due to depression of respiration. Which one of these hypnotic drugs can be injected by rectal route? Chloral hydrate. Salicylate decreases the synthesis of one of these of the following prostaglandins. Paracetamol is hepatotoxic due to its metabolic reactions. The most or metabolites. The most common adverse effect of NSAIDs is gastric upset. Sugandril is a common brand name for oxyphenabutazole. Due to long half-life, a single daily dose of one of these is sufficient, that is piroxicam. Which one of these used in treatment of gout? Allopurinol. Which one of these is mu agonist? Pethidine. Fortwin is a common brand name for pentazocine. In alcoholism, which one of these drug is used? Disulfiram. Chlorpromazine is useful in treatment of schizophrenia. Stemetil is a common brand name for prochlorperazine. Muscle relaxation is secondary effect of benzodiazepine. Tricyclic antidepressant act by blocking the reuptake of norepinephrine. In Parkinsonism, there is deficiency of dopamine. Levodopa is amino acid precursor of dopamine. The most potent CNS stimulant among xanthine bases is caffeine. Leptazole is a stimulant of brainstem. Sugar part in cardiac glycoside is responsible for water and lipid solubility. Toxicity of digitalis is increased due to depletion of potassium ion. Digoxin is useful in treatment of congestive heart failure. Aldomate is common brand name for methyl dopa. Guanetidine lowers down the blood pressure by displacing norepinephrine at ganglionic site. Minoxidil is effective in hypertension due to vasodilatory action. Amlodipine lowers blood pressure by inhibition of calcium influx. Captopril lowers blood pressure by inhibition of enzyme peptidyl dipeptidase. Which one of these isomer of quinidine is effective against arrhythmia? That is D isomer. Cholestyramine is useful in the treatment of hyperlipoproteinemia. Clofibrate mainly lowers the VLDL levels. Lovastatin is useful in treatment of hyperproteinemia. Which one of these vitamin is essential for coagulation of blood? Vitamin K. Which one of these metallic ion is essential for coagulation of blood? Calcium. Chemically, heparin is mucosaccharide. Which one of these is used in overdose of heparin? Protamine sulfate. Oral anticoagulant act by antagonizing the action of vitamin K. Chlorothiazide causes diuresis due to inhibition of enzyme carbonic anhydrase. Main side effect of thiazide diuretics is hypokalemia. Furosemide act on ascending limb of loop of Henle. Which one of these diuretic does not affect the potassium excretion? That is all spironolactone, amiloride and triamterene, because these are potassium sparing diuretics. Glucocorticoids are used in the treatment of both inflammation and allergy. Oral contraceptives contain mixture of estrogen and progesterone. Typhoid fever is caused by Salmonella typhi. Which one of these antibacterial agent is effective against typhoid fever? That is chloramphenicol. The causative organism for pneumonia is Staphylococcus aureus. The effective antibacterial therapy for the treatment of pneumonia includes ampicillin plus cloxacillin. The sulfonamides are bacteriostatic in nature. Sulfonamides are effective against gram-positive and gram-negative microorganisms. Sulfonamides are generally metabolized by acetylation. Stevens-Johnson syndrome is associated with sulfonamides. Triple sulfa is a mixture of sulfadiazine, sulfamerazine, and sulfamethoxazine. Penicillin was discovered by Alexander Fleming. Broad spectrum penicillin includes ampicillin. Penicillinase resistant penicillin include cloxacillin. Cloxacillin and dicloxacillin are acid and penicillinase resistant. Penicillin act by interfering in bacterial cell wall synthesis. Tetracycline act by inhibiting the protein synthesis. Tetracyclines are not administered with milk because it forms insoluble chelate. Superinfection is an adverse effect of tetracyclines. Chloramphenicol act by inhibiting microbial protein synthesis. Gray baby syndrome is associated with chloramphenicol. Aminoglycoside antibiotic act by inhibiting protein synthesis. Which one of these antibiotics is effective against Pseudomonas aeruginosa responsible for eye infection? That is gentamicin. Ototoxicity is important side effect of streptomycin. Erythromycin act by inhibiting protein synthesis. Amphotericin B polyene antibiotic act by interacting with fungal membrane sterol. Nystatin is principally effective in Candida albicans. Which one of these is not an antiviral agent? Hemicin. First line drugs for tuberculosis include isoniazid, rifampin, ethambutol, and pyrazinamide. Pyridoxine is administered with isoniazid to minimize the neurotoxicity. Rifampicin is produced by Streptomyces mediterranae. Which one of these antibiotics is effective in leprosy? Rifampin. Combination therapy is adapted in treatment of tuberculosis to reduce the bacterial resistance. Niclosamide is used in the infection caused by cystodes. Pyrantel pamoate is used against worm as in it causes spastic paralysis of the worm. Which one of these is effective against W barrow, that is diethyl carbamazine. Metronidazole is effective in amoebic dysentery. Which one of these antibiotics is used in amoebic dysentery? That is paromomycin. Which one of these act as casual prophylactic agent in malaria? Primaquine. Which one of these act as erythrocytic stage? Chloroquine. Which one of these combination is used in the chloroquine resistant malaria? That is pyrimethamine and sulfadoxine. Which one of these enzyme is used in the treatment of cancer? L-asparginase. Paraldehyde is administered by rectal route. Enteric coated tablets are used to avoid gastric irritation. Isosorbide dinitrate is usually administered by sublingual route. Which one of these route is mostly adopted in emergency condition? Intravenous. The volume of infection should not the volume of injection should not exceed 10 ml in intramuscular route. Iserine act by drug enzyme interaction. Methotrexate is antimetabolite. Desferoxamine is a chelating agent. Phenytoin act as anti-epileptic drug by acting on cell membrane. The term bioequivalence means comparison of various formulations of the same class of drug. Levodopa is converted in body into active metabolite. The slow metabolism of isoniazid in Africans is due to genetic variation. Phocomelia induced by thalidomide is teratogenic disease. The concentration of pilocarpine nitrate used in the treatment of glaucoma is 0.5 to 4%. Which one of these is a diagnostic agent for myasthenia gravis? Idrophonium. Homatropine hydrobromide is used as mydriatic in the percentage of 1 to 2%. Which one of these is used with hyoscine to induce twilight sleep? That is pethidine. Cardiovascular action of epinephrine is mediated through beta receptor. Which one of these has smooth muscle relaxant property? Isozaprine. Illupent is a common brand name for orsiprenylene. Ergot preparation are useful in migraine due to its vasoconstriction action. The drug of choice in status epilepticus is diazepam. Which one of these hypnotic possesses a muscle relaxant property? That is diazepam. Paracetamol is excreted as glucuronide. Which one of these is a precursor of dopamine? That is levodopa. Sodium valproate prevents the epileptic seizures by preventing influx of sodium. Which one of these is essential for cardiac activity of glycosides? Alpha beta unsaturated lactone. Secondary hypertension may occur due to atherosclerosis. Which one of these hypertensive drugs is also used as tranquilizers? Reserpine. Which one of these vitamin possesses lipid lowering property? Nicotinic acid. The thromboplastin is necessary in blood coagulation for converting prothrombin to thrombin. Which one of these vitamin is essential for absorption of iron? That is vitamin C. Which one of these is naturally occurring corticosteroid? Hydrocortisone. Corticosteroids are useful in treatment of arthritic disease, allergic reaction and bronchial asthma. Sulfonylureas decrease sugar level by release of insulin from beta cells. The Saheli oral contraceptive contain non-steroidal compound. Which one of these general anesthetic is toxic to liver? Chloroform. Penicillin is inactivated by beta-lactamase. Which one of these does not possess anti-Parkinsonism action? That is carbidopa. Which one of these is useful in severe allergic condition and emergency? Dexamethasone and adrenaline. Which one of these is major tranquilizer? Trifluperazine. Valium is a common brand name for diazepam. Dose and frequency of administration of drug is determined by half-life of drug. Sodium nitroprusside is not used as hypotensive drug because it has short duration of action. Which one of these statement is true for prodrug? Prodrug is more active. It needs metabolic activation and it is less toxic. Coramine is diethylamine nicotinic acid. The Streptomyces venezuelae produces chloramphenicol. The drug promethazine belongs to the category of phenothiazine. Niclosamide is used against tapeworm. Originally, oxytetracycline is known as terramycin. Chloropamide increases insulin secretion. Drug of choice in acute attack of migraine is ergotamine tartrate. Which one of these is not given in urinary tract infection? That is tetracycline. Which one of these is not a hepatotoxic? Diflunisal. Which one of these is a potassium sparing diuretic? That is triamterene. The excretion rate of isoniazid is low due to slow acetylation in some individual. It is called genetically determined disorder. Of the many types of data plots that are used to help explain the pharmacodynamics of drugs, which plot is very useful for determining the total number of receptors and the affinity of drug for those receptors in tissue or membrane? That is scattered plot. Which route of administration is most likely to subject a drug to the first pass effect? Intravenous route. Two drugs may act on the same tissue or organ through independent receptors, resulting in effects in opposite direction. This is known as irreversible antagonism. The pharmacokinetic value that most reliably reflects the amount of drug reaching the target tissue after oral administration is area under the blood concentration time curve, that is AUC. It was determined that 95% of an oral 80 mg dose of verapamil was absorbed in 70 kg test subject. However, because of extensive biotransformation during its first pass through the portal circulation, the bioavailability of verapamil was only 25%. Assuming a liver blood flow of 1500 ml per minute, the hepatic clearance of verapamil in this situation was 1110 ml per minute. Drug products have many types of names. Of the following types of names that are applied to the drugs, the one that is the official name and refers only to the drug and not to a particular product is the generic name. Which one of the following is classified as belonging to the tyrosine kinase receptor family, that is insulin receptors? Of the following, which is a phase 2 biotransformation reaction, that is sulfate conjugation? Which one of the following is unlikely to be associated with oral drug administration of an enteric coated dosage form? That is variability in absorption caused by fluctuation in gastric emptying time. The greater absorption of a drug administered orally will be absorbed in the small intestine. However, on the assumption that passive transport of the non-ionized form of the drug determines its rate of absorption, which of the following compounds will be absorbed to the least extent in the stomach? That is propranolol with pK 9.4. Of the following, which is unlikely to be associated with receptors bound to plasma membranes, their interaction with ligands, and the biologic response to this interaction? That is, activation of the membrane bound receptor and subsequent intracellular events elicit a biologic response through the transcription of DNA. Of the following, which is unlikely to be associated with the binding of drugs to the plasma proteins? Plasma protein binding generally limits renal tubular secretion and biotransformation. The greater proportion of the dose of the drug administered orally will be absorbed in the small intestine. However, on the assumption that passive transport of the non-ionized form of the drug determines its rate of absorption, which of the following compounds will be absorbed to the least extent in the stomach? That is propranolol with pK 9.4. Lipid soluble xenobiotics are commonly biotransformed by oxidation in the drug metabolizing microsomal system. For each description below, choose the component of the microsomal mixed function oxidase system with which it is most closely associated, that is NADPH. Possible